Okay, welcome back to Twig. Twig stands for This Week in Global Health. Twig is a weekly live global health news roundup. We've got a live audience, so if you're watching this, please interact with us on Twitter or at the webpage, which is twig.org. If you're watching this on YouTube, welcome, of course. And, of course, we have a podcast, so you might be listening to this, and we love you guys. Thanks for tuning in. Right, this week we're going to be talking about the Ebola epidemic again. We've done a few episodes on this before, but now we're doing a little bit of a retrospective. We're looking back. It's about a year later since this whole thing kind of kicked off, and we're gonna have a quick look back at what's happened. Before we carry on, I'm gonna ask the team to introduce themselves. I'm gonna start with myself. My name is Greg Martin. Jessica, over to you.
Hi everyone, I am Jessica Taff, and I'm coming to you from the Washington, D.C. metro area today. Today, like Greg said, we're going to be talking about Ebola. I'm going to give you a timeline of it and be telling you about some lessons, things that we've learned from it.
Okay, Katie. Katie, tell us, what are you going to be talking about today?
Hi everyone, my name is Katie Jackson. I'm coming to you from Stockholm, Sweden. Sorry, I'm crying. I have a cold right now. But I'm going to be talking to you about rudimentary healthcare centers, as well as doing a little segment called Katie's Career Corner.
Katie's Career Corner. We like it. Okay, Chris, talk to us.
Hi everybody, I'm Chris Ronson. I'm coming to you from San Francisco, California. I'm very excited about Katie's Career Corner, and I will be talking to you about all of the things Ebola related as well. So it should be a great episode. Greg might rap for you.
Okay, you're going to be talking about all things Ebola. That's a little bit, okay, the mystery is there. We're intrigued.
Mm-hmm.
Well, we're going to start off. Ordinarily, we have Brian Simpson from Johns Hopkins University, the Global Health Now newsletter, giving us a news update. He can't be with us tonight, but Chris is going to do it for us. Chris, give us the news. What's happening in the world of global health at the moment?
Okay. Well, let's see. I'm going to start off with, we actually got all of our stories from Global Health Now at Johns Hopkins, so thank you to them for providing us with some great content. The first story is going to go into maternal health and child development. A recent study at Princeton found that Indian women end their pregnancy weighing less than African women, or specifically sub-Saharan African women, do at the beginning of their pregnancy. They're also generally severely anemic, both factors of which have profoundly negative effects on the developing child. 42% of Indian women are underweight when they begin their pregnancies, compared to 16.5% of women in sub-Saharan Africa. Now, factors cited as contributions to this status are Indian mothers' poor health, including infections due to primitive sanitation in the country, as well as the inferior status of women in Indian society. India accounts for about 1/6 of the world's population, but 1/3 of all newborn deaths. And we're going to include the link to all of the stories we've mentioned in our show notes. You can also get them through the Johns Hopkins newsletter. This one came to us from the New York Times. The next story that we've got is on São Paulo. Yes, droughts and dengue. Inhabitants of Sao Paulo, Brazil, are suffering from the worst drought in decades, but have also unwittingly contributed to an outbreak of dengue fever by storing scarce water in open containers. The outbreak has sparked a panic in the city of Sao Paulo, where 563 people have caught the disease so far, which is an increase of over 160% from this time last year. Now, dengue is a persistent problem in Brazil, especially during the rainier seasons of January and February, but during this drought it's worsened due to water conservation strategies within the city itself. It has cut off running water to millions of customers for hours or even days at a time, and residents have responded by hoarding water in open containers. In efforts to increase awareness about the problem and ways to circumvent it, local media have featured photos of pro soccer or football, depending on where in the world you are, players being doused with bug spray before venturing into matches. Residents are snapping up repellent, mosquito netting, insect zappers, and foggers in a bid to keep the mosquitoes from biting.
Yeah, and it's really interesting that there is such an unintended consequence from just saving some water. Sao Paulo is a really big city, and I think it has some of the worst traffic jams in the world, for example. So it's a really big city, and to not have consistent water, yeah, you'd save a little bit of water, but I think it's really interesting to see how that has turned into an unintended consequence, aka the spread of dengue.
Yeah, it also sort of shows a parallel between the effects of climate change on global health. So you've got the drought, you've got people trying to conserve water because of reduced water pressure in their piping system, and then now we have this outbreak and this increase in the incidence of dengue. So
and if
very important
if you're interested in climate change and global health, we've done an episode on that. Does anyone know what number episode that was?
5.
Number 5? Okay,
Yeah.
number 5. But if you go to twig.org, CWIGH.org, it's easy to find. Episode number 5, Climate Change and Global Health.
Yep. All right, and then that'll bring us to our last news story of today. This one actually discusses Ebola halting the progress of HIV interventions in Sierra Leone. The United Nations reports that the West African Ebola outbreak has halted progress in tackling the HIV/AIDS epidemic that was already there, shutting down health clinics and scaring patients away from being tested or seeking treatment. Hospitals have closed down because they've been overrun by Ebola patients, and non-Ebola patients are often too afraid to go in and seek treatment because of the proximity to the disease. Now, some 25% of patients taking ARTs or antiretroviral therapy for the virus that causes AIDS are missing clinic appointments in and around Freetown, which is Sierra Leone's capital, and those are also where the main Ebola-affected communities are. There's also been a decline of at least 70% in HIV testing and counseling services. So essential HIV drugs are either expiring or becoming out of stock, according to a UN document. So this also, just so you know, brings us to the worst recorded outbreak of Ebola that has already placed immense pressure on weak health systems in the hardest hit Sierra Leone, Guinea, and Liberia.
Okay, thanks very much, Chris. Now, this is about a year later since this whole thing started off. Well, I mean, we don't have, I'm not going to talk about exact dates because I'm going to ask Jessica just to give us a bit of a timeline of when this all began and how things started unfolding. Jessica, can you just start talking us a little bit about the history of this epidemic?
I can do that. All right, let me break this down for everyone. I'm going to tell you guys a little story. All right, so in late 2013, a 2-year-old boy from Guinea consumed bushmeat that was infected with Ebola virus. Now, this bushmeat, it could have come from squirrels, monkeys, or an antelope, something like that. From there, this virus spread out into 4 chains through Guinea and then later spread into nearby Sierra Leone when people were seeking treatment from a widely respected traditional healer. She contracted the virus and then she died, and then hundreds of people that attended her funeral also became ill and infected, and they later died too. By March 25th, 2014, the WHO officially came out and declared that there was an outbreak in Guinea, and they also said there were suspected cases in Liberia and Sierra Leone. Then by March 31st, there were 122 patients suspected of contracting Ebola with 78 deaths, and most of them were in Guinea. Now, it's important to note at this time, Médecins Sans Frontières is calling the outbreak unprecedented, but WHO says that while it's serious, it's still relatively small.
I mean, it's quite interesting, Jessica, because I remember at that point in time feeling as if we were really getting 2 different messages. You know, I really felt like the WHO was saying nothing to see here, not a big deal, business as usual, and MSF was saying absolutely big deal, this is huge. I mean, is that about right? We were getting these kind of like 2 different messages really from the organizations?
No, yes, that's absolutely true, Greg. And by late June, also, MSF called the epidemic out of control, and they asked for a massive deployment of resources to control it from spreading to other areas. WHO at this point is reporting over 600 cases and 390 deaths. And then by the end of July, the virus had infected 1,200 people.
And it's about then that we really start seeing the Ebola virus story hitting the mainstream media. I mean, is that like literally on TV?
Yeah, no, yes, very much so. At this point, by July, the outbreak had gotten a lot more attention, especially when 2 American patients contracted the virus and then were brought to the United States for treatment. The United States National Institutes of Health also decides at this point that it will start testing an experimental Ebola vaccine. It isn't, though, until August that the WHO finally declares a public health emergency of an international concern, and then the UN steps in to declare it an emergency health mission for Ebola, which is a little later, and which is important to note because this is the first emergency health mission that the UN has ever declared. Then, by October, there were over 10,000 cases and 5,000 deaths in this outbreak. The majority of them were in the 3 West African countries. Then there were some cases also in the US, Senegal, and Nigeria. But let's bring it back today. So where are we today? Well, there have been nearly 24,000 cases and almost 10,000 deaths. The rate of new infections has declined, thank goodness, but the outbreak is far from over.
Wow, okay, thanks very much, Jessica. So that's a really interesting synopsis. That's kind of how we've gotten to where we are now. I think let's just change tack slightly and let's talk about what we've learned. So looking back, what are the lessons learned here? Chris, over to you. Can you just talk to us a little bit about what the lessons learned?
I most certainly can. So the timeline that Jessica just outlined for everybody really puts into perspective how what started out as a small epidemic, not even an epidemic at that point, but really took off globally. As she mentioned, it spread to the EU, it spread to the US, and it spread within Africa itself. It's really important to consider how this epidemic manifested in terms of past Ebola epidemics, of which there have been 24, and none of those ever killed more than about 300 people, and they remained relatively local, obviously unlike this one. One of the things we've learned is, and that is important to take into consideration, how transmission was sustained. Now, a Lancet study showed that after countermeasures were put in place and hospitals and funerals in Guinea, which, remember that sort of traditionally or culturally, West African funeral practices can include touching and or kissing the bodies as a sign of reverence, and that also facilitates virus exposure. So at these hospitals and funerals, transmission was sustained primarily in those local communities, 72% of it between family members. And that really shows the importance of battling an epidemic at the community level, as well as considering community practices and beliefs in the implementation of strategies.
Yeah, and that's a really good point as well, because it's always important to take into consideration involving community leaders, as community members will be much more trusting of their own than of foreigners.
Yeah, absolutely. Couldn't agree with you more.
Yeah,
sorry. Jump right in.
On that note, it just sort of took me back to last week where we did the interview with Hans Rosling, and he sort of spoke about how he's been really, really impressed with the caliber of like the physicians and the staff and everybody that he's seen working in West Africa. So, the fact that we can use people as these existing resources and really, it looks like they're experienced and strong enough. What we need to help do is obviously strengthen those systems. But it's great to hear that he has such a really positive reflection on his time there and the people that he worked with.
Yeah, and I think he called it the New Africa, and I really liked him thinking about that and how he was there just to aid, and I really liked his vision on that.
Mm-hmm.
And I mean, just reflecting back on what Hans was saying in our interview with him last week, which, by the way, if you haven't seen it, watch it. It was absolutely fantastic. We all loved it. He's a bit of a legend, to say the least. But Hans was also talking about, when we asked him about skill sets needed in the global health space, he talked about anthropology as being particularly important. And as well as economics and other things. But I like that he said that, and I think that ties in with what you've just said now, Chris.
Mm-hmm.
Definitely.
Anyway, Katie, you're going to talk to us about using rudimentary facilities in the response to the Ebola epidemic.
Definitely. So in a lot of discussion that we've had around Ebola, it has implicated poor health systems as into why this outbreak is so difficult to control. And actually, I tweeted from Adam Hoverman, and he was saying that one of the lessons learned this year from Ebola was about health system strengthening. So we've spoken on this in previous shows, and we won't get too much into it. But a study published by CDC credits Ebola treatment centers and community care centers, so smaller centers in Liberia, for saving thousands of lives. And the lesson here is that even in poor health systems, isolation of the infected, even in simple treatment facilities, can make a really significant difference.
Very much so. And I think that also sort of ties in or goes back a little bit to what we just discussed, which is being sensitive anthropologically and medically to people's cultural differences, and that just implementing those simple changes can have a huge difference. One of the largest challenges we had in the outbreak had to do with keeping people from touching the bodies of the deceased Ebola victims, as were the local practices. I remember, too, reading a story that was sort of talking about how there was a huge cultural shift in Liberia because people in the communities or in that country are generally very friendly and affectionate, and it sort of put a moratorium on them behaving as they culturally normally would, which is a sad thing to see, but also something that's very effective in reducing transmission. Another thing is that when Westerners first ordered the body bags for burials in Liberia, they ordered black body bags, which is traditional in the U.S., but it didn't go over well because, especially in Muslim cultures, the traditional color of mourning is white. So had we simply ordered white body bags, which is more in keeping with their beliefs, it probably would have gone a lot further, just even as a gesture.
That is super interesting. I didn't know that, actually. I'm learning stuff right now, so that's fantastic. Thanks very much for that, Chris.
What we're here for.
Jessica, can you just talk to us a little bit about the way forwards? So what do we need to do to prevent this kind of thing happening again in the future?
Well, One thing we need to do is we need to invest in science for preparedness and rely on it to guide policy during an outbreak. This outbreak ignited a lot of activity in the scientific realm, from quickly driving forward existing research into clinical trials and usage of experimental Ebola vaccines and drugs, to discussing the science and epidemiology of Ebola in public and policy forums. We learned that we cannot be complacent in developing new health technology to fight potential pathogens that may or may not cause a crisis. For instance, imagine had we had an effective vaccine at the start of this crisis, or drugs to treat people. If we had had that, the death toll would have been much lower. Furthermore, the science of any disease must be communicated clearly in a crisis and used in policy to reduce unnecessary panic and counterproductive measures. For instance, the quarantines that were getting called on returning Ebola healthcare workers that weren't showing any symptoms were completely unnecessary, and it only discouraged others from volunteering to help. Though this does bring me to another important lesson. There will continually be tension between science and politics and a public response during any health crisis. And we must recognize this, and we must be prepared to manage it very carefully.
That's a great point.
Totally agree.
Sorry, I was on mute. Yeah, and that's a really good point, because how many outbreaks that spread globally do we need for this idea to stick? We've seen it with bird flu, we've seen it with SARS, with MERS, dengue, chikungunya, West Nile virus, and now Ebola. And maybe this time, with the amount of attention this received, having the first UN declared emergency, because maybe then we'll understand that we are all connected and we're not prepared.
And let me just say, this will not be the last zoonotic epidemic or pandemic that we see.
Definitely not.
Just in our lifetimes, we've seen SARS, Ebola, HIV. I mean, these are things that didn't exist before I was born, or we certainly didn't know about them. And so it makes you think, what else is waiting in the sideline that's going to pop out and affect humanity, especially with the increased travel and population density, et cetera, et cetera. So getting ready for these things is extremely important. Chris, more about getting ready and being prepared for the future. Talk to us.
I can. I'll make it really brief. Addressing outbreaks and preventing their spread require ongoing surveillance, shared global intelligence, rapid, cooperative, and coordinated global response when an outbreak does occur, which is why we have a lot of these supranational institutions. Poorer states, though, may need assistance in building capacity for surveillance and response, and helping them do so is in the interest of wealthier states, because as we've learned, this could potentially spread to us. We are all connected, and we need to, quote unquote, nip it in the bud. And there's actually some really interesting facts that we found that I'd like to share with the people who stick around for discussion. So stay tuned after the show.
Okay, stay tuned. And finally, I think we can't have a discussion about what's happened in the world over the last few months with respect to Ebola without talking about leadership. Jessica, could you perhaps jump in here and just talk a little bit about leadership and the Ebola epidemic?
Right. Well, all right. Well, we did promise we weren't going to focus on criticisms in this episode, and we really won't. But we would be remiss if we didn't address the lack of global health governance and leadership that was during this crisis. The response from WHO and the rest of the world wasn't appropriate, as it left the early response to the outbreak up to countries that really didn't have the capacity to address it. And even once WHO declared the outbreak a public health emergency of international concern in August, the response still wasn't quick enough. Financing of the response, recruitment of health resources, and the deployment all took too long and was held up by bureaucracy. WHO Director Margaret Chan herself has admitted that the WHO was not prepared for this crisis. And she has called for major reforms that would change the nature of the WHO from an organization as it currently is, from one that provides technical guidance and guidelines to one that actually has operational capacity, which is a big deal. These reforms include a $100 million emergency fund and a pre-trained cadre of public health and clinical emergency responders. And I'm sure we're all going to be really interested to see how these go and see how this pans out in May, when the World Health Assembly will be voting on these reforms that Dr. Chan has called for.
Mm-hmm.
I mean, it's quite an interesting suggestion from Margaret Chan, and it would be an interesting discussion to have, perhaps in the discussion section at the end of the show. We always have a discussion section that's not on YouTube and won't be on the podcast, but we, for the live audience, we have some ongoing discussion, because the WHO's failure wasn't in its ability to operationalize. It's the failure, according to many authors and scholars, was in leadership and communication. And it feels as if by saying, oh well, we need money to be able to be more operational, is kind of almost sidestepping the real problem. and that was that perhaps Margaret Chan and the WHO failed to really take a leadership role in addressing and coordinating the response to the Ebola epidemic. Anyway, right, enough of that. What we're going to talk about now is careers. I know a lot of the people that watch the show are interested in working in global health, or perhaps you're watching the show for the first time, and we often talk about students and young professionals. It's a large part of our audience would be that. Katie, who's got a lot of background in careers counseling, does a little thing called Katie's Careers Corner, and she just highlights 1 or 2 jobs that are available in the global health space at the moment. Katie, over to you.
Sounds good. Okay, so this is going to be a new segment called Katie's Career Corner, and what I'm going to do, like Greg said, is just highlight a few jobs. So in keeping with today's episode, the first job that I'm going to highlight is Ebola Response Consortium, so ERC WASH Project Coordinator in Sierra Leone. So just to continue thinking that, we perhaps in Western media, it's not as talked about anymore, but Ebola still is a disease that is going to take a long time to stamp out completely because of all the complications that we talked about today. And the second career job is Rapid Response Team Nutrition Cluster Coordinator with Action Against Hunger. Sorry, the first job was at the International Rescue Committee, I forgot to mention. And this one is with Action Against Hunger, so that's for anyone that's interested in nutrition. And we will put those job postings in the show notes, and we'll also put them on the website, so you can check the website. And if you have any jobs or opportunities, if you're an organization or if you hear of one, just use the hashtag TWIG, so that's hashtag TWIGH, and we'll put it in the next show. You can find us there, and you can also find us at Twig Team on Twitter.
Okay, so how can you get in touch with us? Katie just mentioned there's the hashtag Twig, there's the @Twig Team on Twitter. There's hello@twig.org. You can email us. You can go to our webpage, www.twigh, that's twig.org, and there's a form that you can fill in there, and it'll send us a message. We respond to everything. So if you reach out to us, I can absolutely guarantee you we'll get back to you. And of course, if you're watching this on YouTube, underneath the YouTube video, there's space for comments and discussion, and as a team we engage with any, so if you make a comment down there, we'll respond and engage and get involved with that conversation. So please interact with us. We love you guys. That'll be Chris, you've got something to say.
Oh, I just wanted to say we're also on I can't remember now, I'm having a blank out. We're on Facebook, and we're also on LinkedIn, and we do a lot of engagement.
And Instagram.
And Instagram. All of the things.
All of the things. You can find us on any social media platform.
And we're actually on Tumblr as well, and we've made an extensive thing on Reddit.
Are we in Chinese social media as well?
Yeah, Youku. If you're in China, then you already know that we're on Youku, because that's the only place you can watch us. Okay, so basically we're everywhere.
We're slowly taking over.
Exactly. Listen, thanks everyone for watching. We're going to go into a discussion section now, so if you're watching live, don't go away. And at this point, we'll be responding to questions that might have come in over Twitter or via the internet. For people watching this on YouTube or listening to the podcast, thanks for watching, thanks for tuning in. We're going to be here same time, same place next week, so come again soon. Don't do drugs, always do your best, don't ever change, and see you next week. Bye.
You're not going to rap?
You'll have to talk me into that.
Okay.